So troubleshooting, common problems that you may encounter whilst breastfeeding. So breastfeeding should be 100% pain-free and comfortable. If you do have sore nipples, unfortunately it can be that baby's just latched on wrongly, maybe a few times that have damaged the nipples, and then it's a few days of healing. So please make sure that you get help in order to why you become sore. So a lot of reasons for soreness is purely position and attachment, but it may be that your baby has a tongue tie. If that is suspected, then your community midwife team will contact us and we can arrange a one-to-one appointment with us. If you do have any concerns when you're at home, please email us and then we can contact you and arrange to speak to you either by phone, by audio, FaceTime, to be able to support you with position and attachment. So it's making sure that your babies are positioning and attaching effectively to rectify sore nipples. Just gently squeezing a little bit of the milk, the end of the nipple, rubbing it in. All of the protective factors in breast milk will heal sore nipple. Lanolin-based creams are good in order for moist wound healing, to be able to rub on your nipple to be able to soothe it. However, unless the source of the problem has been dealt with, that will just continue. So please make sure that you access help with position and attachment. Blocked ducts, really important to feel regularly on your breast and up under your armpit, because your breast tissue extends up under the armpit for any lumps that you feel. The chances are they're blocked ducts, and one or more of those can become blocked at any point. Really important that you clear a blocked duct, because a blocked duct that doesn't get cleared can cause an infection called mastitis, which you definitely don't want. So blocked ducts, you'll feel lumpy. So make sure that your baby's feeding well to be able to clear the blocked duct. It may be that your baby's latched onto the breast, and some mums, if they've got larger breasts, then hold their breast throughout a feed. Well, I'm blocking whatever ducts are underneath there. So really important that when baby's latched on effectively, you bring that hand to meet the other hand, relax your shoulders and let baby begin feeding. It might be that you have a badly fitted nursing bra that's digging in, and that can cause a blocked duct. So there are a number of reasons why you can get a blocked duct. If you do feel that a duct is blocked, do exactly the same thing for hand expressing. So literally massage, maybe get a nice warm flannel on, really massage out that blocked duct. You can get in with your thumb and really sort of massage out that blocked duct. If it has turned to mastitis, you will know because you'll feel poorly. You feel a bit flu-like, so you'll feel achy, you may have a temperature, because you'll get two types of mastitis, infective or inflammatory, but you'll still feel the same symptoms, whatever. If you have got an infective mastitis, you'll have a high temperature as well. Really important that you go straight to the GP for antibiotics. Obviously at this time with the coronavirus, make sure that you contact the GP. They'll be able to do a virtual chat with you and leave you out a prescription for antibiotics. So with mastitis, apart from feeling unwell, you'll get a lumpy breast, which is obviously the blocked duct, but also it's like one or two of these alveoli being inflamed or infected. So you'll get a patch about that size of red or pink on your breast. And as I say, you'll just feel really poorly and like you've got a good dose of the flu. So straight for antibiotics. Make sure that you're feeding well, because it's not an infection of the milk, so it's perfectly safe for your baby to continue feeding, because that will help to clear the mastitis. Make sure you have lots of rest, fluids, have paracetamol, because that will take down temperature, and ibuprofen will be the anti-inflammatory as well, so you can have ibuprofen as well. Also, how to if you're worried that your baby's not getting enough milk at any point. So remember the guide to wet and dirty nappies. If your baby has fewer number of wet or dirty nappies than we talked about, that's an indication baby's not getting enough milk. So again, seek help from your community midwife. Us as a feeding team on our email, we can talk to you. So making sure that your baby's feeding 8 or more times in 24 hours, between 5 to 40 minutes in length. It shouldn't, as I say, be pinchy or bitey. It should be pain-free. And if you're noticing that you're getting fewer of those number of wet and dirty nappies, that's a reason for you to take the lead. So it might be that we ask you to pump or hand express your milk out to be able to collect a bit extra to give your baby. So again, remembering your hand expressing is obviously the same that we talked about earlier for colostrum harvesting, but also you can get a pump, put a pump on. The best time to pump or hand express is immediately after feeding. So you don't need to wait for your breast to fill up. It's an instantaneous action. So once you've breastfed or pumped, and your baby either wants to feed again or you want to pump, you can do that straight after. So popping a pump on. If you've got a double pump, that means that you'll get about 18% more milk yield, and taking half the time as well. So double pumps are good. Electric pumps really help with getting the maximum amount of milk out that you can. Once you've had your baby, you'll be identified, or your baby will be identified according to whether they're under the green hat, bobble hat, amber or red hat. That's just a guideline we use for if your baby has any risk factors. So if you have a normal delivery, minimal blood loss, no risk factors, you'll probably be under the green hat pathway, and that just means make sure that your baby feeds responsibly. So go with feeding cues, making sure your baby feeds 8 or more times in 24 hours, 3 to 4 times in the first 24 hours of life. If your baby's identified as an amber hat, it might be because you've lost a little bit more blood than we anticipated. It might be that you've had an emergency cesarean, a ventouse or a forceps. So those babies go under the amber hat guideline. If you've got diabetes, your baby has an infection, you'll be under the red hat pathway. And for the amber and red hat pathway, we say 2 to 3 hourly feeding from birth. So instead of just 3 to 4 in the first 24 hours and 8 or more thereafter, we say 2 to 3 hourly from birth. If they haven't fed within the first 2 hours of birth, then for all babies, we suggest hand expressing to get some colostrum out to be able to give baby a bit extra with a syringe or a cup. And your midwife will be able to explain and guide you, make sure you're happy to be able to do this yourself as well. If your baby's amber hat and at 6 hours isn't feeding, at 12 hours isn't feeding, then that would be a reason to be hand expressing and giving your baby extra milk. If your baby's a red hat guideline, then it will be at 6 hours, so a bit earlier that we would then be saying we need to pump, hand express and give your baby a bit extra. But your midwife will let you know when you've had your baby which pathway you fall into. Please make sure that your baby's feed, you have at least 2 feeds observed by the midwifery team before you go home, and that you're really happy with position and attachment before you leave. If you're in the hospital, we have our feeding hub, which is on the ward next to the nursery. We ask you to come down just for help, and there's somebody in there all the time out of the feeding team that can help you. If you've gone home, please email us and we can contact you, and we can do a virtual chat with you, or we can text you, however, or speak to you on the phone, however you prefer.